Hey everyone, welcome to the Womanhood series. We are back. I am Siobhan, if you don't already know, and thank you so much for tuning in with us. Today we have an amazing topic. We kind of touched on it before. It's the menopause, but this time we are going to talk about the science behind it, and I have a fantastic guest with us today, Dr. Pearl. She is a medical doctor and she's also a health coach as well. So let me not delay. I'm going to bring her on screen now. Hello, Dr. Pearl. How are you?
Hi, Siobhan. Thank you for having me. Hi, ladies. It's good to be here. Thank you so much for having me. It's an absolute pleasure.
You are absolutely welcome. No, thank you so much for being with us. Honestly, it's been a long time coming, let me say that, because we had the conversation of the menopause. I think it was like our second episode, and more people wanted to know more about the science behind it. So we're really thankful to have you today. So thank you. Okay. So let's crack on. So I'm going to start with a simple question. And I say it's simple, but it probably isn't, because a lot of us don't really know. But what is the menopause?
Thank you so much. Now, the menopause is, it's a topic very close to my heart. And I think it's a topic that everybody should get to know about, men and women, or women and men in particular, because, if you're a woman and you get to that certain age, you will experience it. And if you're a man and you've got a wife or a sister or a partner, then you need to be able to understand the changes that her body is going through so that you can understand how the menopause is affecting her, and then you don't get the unnecessary friction, and you can support your partner, or your wife during that period. So it's definitely it's very topical, and I think it's a discussion that is now really back in the forefront, because lots of women are still at a time when they're working, they're productive, they're, in their sort of probably at the peak of their career, or they're changing career, or they're really, really productive members of the society. So it's a really, really important topic. Now, you asked, what is the menopause? Now, I could answer that directly, but I think it's probably important to step back a bit, so that we can understand, not just the menopause, but also the perimenopause, because that's really what those are the periods that actually women have a lot of symptoms, but maybe go unrecognized for a long time, and a lot of them may be wrongly diagnosed, or they're suffering with symptoms that they ascribe to lots of other conditions, but they are actually going through the perimenopause and into the menopause. So the perimenopause in particular is that period of estrogen decline in the body. Now, we know that the female body makes two main female hormones, estrogen and progestogen. And these hormones, they're made from, they go through probably, what you call a cycle, a cascade from the brain. It releases, they have hormones that are released from the eggs and from the ovaries. And these, and these are what maintain the female cycle. So, the period of, having a period, getting ready for pregnancy. If pregnancy doesn't occur, you have another period. And so that's, that cycle is what those hormones maintain. Now, the whole essence of the perimenopause, or that cycle, is really to prepare a female body for pregnancy and childbirth. But of course, there's only so many children you're going to have. There's so many times you're going to have babies. So eventually, the female body, gets to a point where those hormones that enable you to have that regular cycle and, be fertile gradually decrease. And that period from the time when you have that real decrease in your fertility up until your period stop is called the perimenopause. The menopause, technically, that's from a very medical point of view, is what we call a look-back diagnosis. So you can only say you're menopausal when you have not had a period for 1 year.
Right. Okay.
Yes. So that is the clinical diagnosis, is when you've not had a period for 1 year, you're menopausal. Now, the majority of women, in the UK become menopausal usually between the ages of about 49 to 51.
Right.
Yes, most African women, and I've done a little bit of research on this, Black women tend to go into the menopause a little bit earlier. So they tend to go into menopause about the age of 49.
Right.
Yes, and so there are a number of things that make the menopause, make your menopausal period might be a little bit early or a little bit late. So if you start having periods early, you're likely to go into the menopause early. If you start having periods a bit later, then you're you're likely going to go into menopause a little bit later. There are a lot of sort of areas around that. So what happens usually during that period is that if we talk about the perimenopause, because I think that's a really, really important time for a lot of women, because your fertility is declining, which may or may not be a good thing, depending on where you are with your family and your own life circumstances. But also the estrogen, the female hormones, the estrogen and the progestogen, what they do is that they maintain a whole host of estrogen dependent tissues. So, everything from your cycle, your breasts, your vaginal area. We also know that it's important in your joints, your bones, it's even in your muscles, your ability, your concentration, your libido, all of those things, are all dependent on your estrogen, the amount of estrogen you have, your estrogen levels. And of course, even, you find out that even your skin, your hair, so the typical female hairline is, and your hair density is also maintained by, your estrogen level. So you find out that when women go into the menopause, they begin to lose their hair. They get that thinning on the top of the hair, which which is called in medicine the male pattern baldness, because you have that sort of bald patch. They tend to lose hair on so all of those things, are those areas of your body are really estrogen dependent. And of course, you find out that women may get a little bit more hirsute. That means they get more male-dominated hair. They begin to get, that, middle age spread. So, of course, you might have those, those your lovely curves, but you find, oh my, I'm putting a little bit more weight on my tummy, and I can't lose it. And that is also because as your estrogen goes down, your testosterone levels relatively rise. Not, you don't make more, but because the balance is shifting, so that you now begin to get some of the signs of more testosterone in the female body. And so, so those are sort of your physical symptoms, but of course it has health implications as well. So those changes do have health implications for women. And those are the things that a lot of women may or may not understand, what the changes are or how it's going to affect them going forward.
Wow.
So,
that's already a lot that I had no idea about. And I'm sure many who see this will be like, oh, okay. And so to ask this question, so you've touched on the perimenopause, something that I had never heard of until we discussed it in the first episode. So how long can the perimenopause last?
So typically, most women begin to go, we have what you call estrogen deficiency syndrome, which is perimenopause pretty much. It depends on, as you get older and your estrogen levels get less, then you're more likely to get the symptoms. But technically, it can be anything up to 10 years. So most people start getting perimenopausal from the age of 40. So once they hit their 40s, they're becoming perimenopausal. And that's why, we try and, if you're trying for a family, that's why your fertility starts quite early. And so these are things women need to take into consideration. And I know sometimes it can become an issue because women get careers and we work and we do all these sorts of stuff. And we're looking for Mr. Right, that sort of thing. And so it does have implications, going forward. But definitely something to think about. But by the time you're getting into your 40s, you're 40, 41, then, your estrogen deficiency, which is that perimenopause, then becomes more predominant. And as you get older, so you get into your 40s, mid 40s, late 40s, then then you're more likely at that point, as your estrogen levels are dropping, that's when you're more likely to get, or you then begin to get a lot more of the signs and symptoms that we typically associate with perimenopause and menopause. And then, of course, like I said, menopause can be anything usually from about the age of 49 to 51. So you think, oh, where's that period? It hasn't come. And you check, okay, I'm not bothered. You think, oh, I haven't had it for 6 months. Oh, I haven't had it for 1 year. Then
right.
yes, that's when we'd say technically, you're menopausal.
Okay, right.
Yeah.
Okay, so so the perimenopause can last anything up to 10 years, generally starts around early 40s. You kind of go into the menopause from around 51-ish, depending on when you started to have your cycle.
Yeah.
So, I mean, this is a question that came up before. Is it possible that you can be pregnant and perimenopausal?
So that's a very interesting one. And yes, a lot of women, for a lot of women, it's not a bad thing, because depending on where you, like I said, where you are, in your personal circumstances, knowing that you can get pregnant, even into your late 40s, can be a comfort for a lot of women. But the answer to that is yes, you can do. And so when we talk about, treatment for the menopause or perimenopause, we would always say, well, even if you're thinking about things like HRT and estrogen replacement and all of that, you also need to consider contraception.
Right.
Because you technically, you can still get pregnant, because we don't know exactly when your eggs will stop completely. So then we know they've stopped completely by the time you're menopausal. But when you're going through the menopause and your estrogen levels are decreasing, your egg production is much less, your ovulation is much less, or much less frequent, so it's not as regular as it may be. You might assume, well, I haven't had a period for a couple of months, that's fine, but then you may ovulate and then you get pregnant. So yes, it can happen, definitely. And then, of course, we all know of women who have got pregnant in their late 40s and their early 50s, so yes, it definitely can happen.
Okay,
so,
wonderful.
Yes.
So I guess it's that case of it can be, I guess, quite a confusing time, because if your periods are not regular and you're going through the perimenopause, you may think, oh, it's just that I'm perimenopausal. So it could be quite a shock, I guess, for people to find out that they're pregnant as well.
Absolutely. And and so that's why when we talk about if you come to speak to a menopause clinician or your GP, we'd always talk, we always talk to you about the whole gamut, the whole range of symptoms and life events that might be happening at that time, and how you need to be looking after yourself during that period. And of course, thinking about your fertility at that stage of your life is also a very important aspect of your menopausal discussion, because if for some women, they still may want to still have children and they want to be fertile, and that may be where they're at in their cycle. And for some women, they've had their families and they really don't want to have another baby into their sort of late 40s or early 50s. But you need to have that discussion with your GP or with your clinician, so that exactly what sort of treatment will suit you during that period.
Okay. I mean, talking about that, because I was listening to a podcast on this, and they were talking about having hormonal, I don't know if it was hormonal replacements or some type of hormonal treatment where they were taking hormones. And I was very confused. I was like, okay, so this is new to me again. So what is this whole taking hormones, and how does that help someone to cope through the process?
And that's an amazing question. And if you are, so for those of us that are within the medical field, hormone replacement, and that's what is, or HRT as it's known for short, is very much it's an aspect of women's health that has had a lot of good press, a lot of bad press, back and forth, and so people are really confused with exactly where people stand. And you can see a lot of people, that a lot of people think, oh my God, you can't take HRT, it's bad for you. There were a lot of studies that were done, probably in the 70s and the 80s, and some of them, even the data that was released and the headlines that came out from that actually gave a really incorrect picture about the value of HRT. Now, HRT means hormone replacement therapy. And so really what's happening is when you want to think about hormone replacement therapy is if you imagine that, you've reached into your late 40s, your 50s, your early 50s, your menopausal or perimenopausal, you may have another 20, 30, 40 years of life without enough estrogen to keep your body going. Wow. And, so, and then of course, before I even talk about HRT in particular, you probably ask, but what's the benefit? Why do you need HRT? Why have it? It's natural. Every woman's going to go into it. Why do you need it? Really, because we know that the estrogen or the HRT, there are key areas of a woman's, quality of life, her physiology that are dependent on estrogen, and they're the symptoms that women get from having lack of estrogen that come as a result of the perimenopause and the menopause. So, for example, I've touched about your periods and all, but also we know that it affects your muscles, it affects your sleep, it gives you hot flushes. A lot of women say they have brain fog. They can't think. They put on weight, they lack motivation, they're not, their brains are not as cloudy, especially if you can imagine a lot of women who will be in their early 50s, late 40s, early 50s, at the peak of their career. They're not sleeping, they can't function, they can't get up in the morning, their concentration is poor, you're putting on weight, have a lot of breast tenderness, your mood is bad, you're thinking, oh, am I depressed? You're probably not, you're probably just perimenopausal, and you're lacking estrogen. You're snappy, you're not able to manage your day so well. So there are lots of things that your estrogen levels help the female body manage really well. And so when you don't have enough of it, a lot of women really struggle during those periods, and we find that that's really one reason why a lot of women who get into their early 40s, into their late 40s and early 50s, or get a lot of menopausal symptoms, they cut down on their work, and the studies have shown, I think about, about probably, I think it's about 30 or 40% of women feel that they can no longer continue to work. Or definitely not work at that level, that high-powered level, because of the menopausal symptoms. And so you can imagine you're losing, that really productive ability or capability within your work environment, or within your working group, of all these, women who have really either are at the peak of their careers, or they've had their families and they want to come back into the work environment, and they're really struggling because of, having quite severe menopausal symptoms. And so it's based on this that HRT, or hormone replacement therapy, really comes into its own. And that's really one of the benefits of HRT, is really to help replace those hormones that you're losing. And then allow that woman with her body going through the menopause to function effectively. Your sleep is better, the hot flushes are much more managed or stop, your hair's better, your weight's better, your mood is better, you're not snappy, you can cope, you're not, your muscles are good. We know it's HRT is absolutely fantastic for preventing thinning bones and osteoporosis. We know it's important for reduction of dementia going forward.
Wow.
It's one of the major factors of reduction of what we call all-cause mortality. So if you have HRT, it reduces your risk of death from everything: strokes, heart attacks, strokes, heart attacks, dementia, falls, everything. So it does reduce your mortality or your risk of dying. Of course, there are caveats to that. So it's it's not a single blanket, but there are caveats to that. But on the whole, for a healthy woman, yes, it's a very it does have huge benefits, and and I've spoken to a lot of women who think, well, I can manage the menopause myself, and it's fine, and then 2, 3, 4 years down the line, they think, what, I can't do this. I still have to work. I'm still productive in my job. I still have my family to look after. I'm still a breadwinner. I need to be at the top of my game. And I say, look, let's talk about what's going on. Let's talk about where you're at, and then let's talk about what we can do to help.
Wow, that's amazing. That is absolutely amazing. See, this is the thing. We need to be having these conversations. I'm not sure why, but the menopause seems to be a conversation that is still so hidden. We're not talking about it. And it really needs to be talked about because, as you said, every woman will experience it later on in life, and it impacts our family.
Absolutely.
So let's talk about the family for a minute. So you've got the wife who has the husband. The husband is confused what's going on with the wife. The wife is confused herself about what's going on with her. What type of advice would you give to someone in that situation?
So I think, like I said, with with all of those menopausal symptoms, is that, and it's not a bad thing, is a lot of women, want to look for a cause, which is the absolute right thing. But sometimes you might be looking for the wrong cause, and they want to think, oh, well, I'm stressed, or I'm depressed, or, there's something going on with my boss, or, you have X, Y, and Z. But usually by the time we've looked at all of it, we find out that the estrogen deficiency, which is at that perimenopausal time, may be underlying so many of the symptoms that a lot of women have. Now, when it comes to how do you manage that as a husband, I think it's being sympathetic to your wife, understanding that her body is changing, she understanding that this is a physiological change, so it's a natural change that her body will go through. Understanding that there are things that can be done. I mean, she might be very irritable, she might be tearful, she might be moody, she might not want to have sex because the sex drive is no longer there. It might be that there's, we have what you call genital urinary syndrome of the menopause, which is, those parts of your body, so your vagina, vulval area, that are maintained by estrogen. When you don't have the estrogen, she gets a lot of, you might find that the woman has a lot of, urinary tract infections. Sex is, having sex is very painful. She doesn't want to have it. She doesn't even have the desire. She might have very sore, thin skin down there. So it's, there are a lot of things that, can affect, and so understanding where she's at. And so, and of course, you might find that, she's, because she's not sleeping well at night, because she's getting the hot flushes and the night sweats, she's not less able to cope during the day, she's more short-tempered, she might be tearful. So all of those sorts of things, can happen to a woman during that time. And I would always encourage women to come forward, as a husband, support your wife or your partner, and sometimes she might be thinking, well, there's something wrong with me. Am I, something going wrong? Am I no longer loving? Do I not love my husband? All of those sorts of things. She might be short-tempered, and it's not that she's, that relationship is not there, and that you're not, the love is not there. It might be that she's just not feeling herself, and she's struggling to cope on many levels. And all women, we wear 20 hats every day. You're a mother, you're a wife, you're a, you work, you're a worker, you're a taxi driver to your kids, you're a, you're the secretary for your home, you do all sorts of things.
Yeah, absolutely.
When you find out that you're trying to juggle all of those balls and some of them are beginning to drop, a lot of women feel that they're incapable. Then they're no longer being able to, they're no longer able to perform. They have a lot of self-doubt. They have a lot of, they feel bad about themselves. They feel, they begin to lose confidence. And of course, if your features are changing as well, just as the natural part of aging, she might begin to feel a lot less attractive to her husband or her partner, because the natural signs of aging are coming through, plus the fact that her mood is bad, plus the fact that she's she's perimenopause, she's going through lack of estrogen, and so a lot of things are going on in her life at that time. So a lot of support, a lot of sympathy, a lot of a listening ear, and really just encouraging that woman to to have a chat, go and have a chat with a GP. And I must say that not all GPs are know how to manage the menopause, so really you want to be looking for one who can understand you. And if you go to you go to see your GP and you don't think you're being listened to, ask for a referral to a menopausal clinic. That's what I would say. Ask for a referral to a menopause clinic, for a menopause specialist, because there are. I mean, when I was in medicine 10 years ago, nobody really, even the consultants in the hospital, didn't know anything about menopause.
Wow.
So yeah. So your gynecologists, they didn't know anything about menopause. So it's really, I mean, it has moved on. Don't get me wrong, but so really now you need to be talking to people who know, and it is a lot more in common parlance. But you really need to get to someone who can listen. And I would say, personally, make sure you're looking for the person who's going to listen to you. Because that's really what you want, the fact that, and I know as, Afro-Caribbeans, we may, Africans and Afro-Caribbeans, we might think, well, I've seen the doctor and he said it's fine. If you went to the doctor the first time and he said it's fine and you're still suffering and you haven't got anything, further forward, go back again and ask to see another doctor, or ask for a referral, really, ask for what you need, and do a bit of research. There are really, really good sites that you can go to now to get a bit of information. Don't just do Dr. Google, but go to the there's the really good sites. The NHS website for health is really good. There's a site called the British Menopause Society. Those are sites you can go to begin to get a bit of information. So that's about the man. I think we talk about the woman. If you're a woman, and you are beginning to, you're at that age, you're going into your, early 40s, middle 40s, late 40s, and you're beginning to have, for some women, they won't have the typical signs of menopause, which might be hot flushes and, night sweats, but, they're not sleeping, they're aching, their muscles ache, the joints ache, the mood is bad, you just feel low, you'll become more irritable, you're more tired, you're not able to get up in the morning, you just feel that your concentration is poor, all of those sorts of things. Yes, go and speak to your GP, because what you want to do is to have that health check first and foremost, to make sure that there's nothing else going on, but also to see whether could this be perimenopause? Is this, are these the symptoms that I'm getting? And if it is, what can I do about it? How can I get the help that I need? To help me manage the symptoms. And I think it's ultimately making an informed choice, about what will suit you and what will work for you. And you want to do that with, somebody who understands the menopause, understands the menopausal management and treatment, and the risks and the benefits.
Amazing. Dr. Pearl, you have given us so much information, a wealth of information. I'm hoping that women now, if you're going through these symptoms, you better understand what's going on with yourself. Go get that health check, like Dr. Pearl said. Make sure you find a GP that will listen to you. Because it's true, we are literally working, doing the family, looking after the home, being there for hubby and being that support for him so he can go out and do what he's doing. And it can be a lot. So if you're not functioning well, that can be extremely stressful, overwhelming, and can definitely knock your confidence, like you were saying. So no, thank you so much. I mean, you've answered all of my questions, which is amazing. So thank you so much. I mean, I'll give a little bit of time if anyone wants to ask any questions. We've had a few comments come up saying thank you, interesting topic, really helpful explanation of the benefits of HRT. Thank you. So I mean, yes, because we don't actually, on that point. So Dr. Pearl, why do we not have these conversations? And especially, why do we not have these conversations with the younger people in our families? Why do you think that is?
So I think one of the reasons why, menopause has been, one of the more hidden aspects of, healthcare and women's health in particular is because, for one thing, a lot of women don't come forward. So we think, yes, it's natural, I'll get on with it, that's it. So that's one reason. A lot of women don't present themselves, they don't come forward. Another thing is that there have been studies done in the past about, the risks and benefits of HRT in particular, or hormone replacement therapy, and that is what really sticks in a lot of people's mind, is that there were studies done with one is called the Million Women Study, and they were looking to see whether HRT was beneficial, but what they did is they used women who were probably from a very narrow demographic, so ethnic demographic. They were much older, so they were in their, the median age is about 68. They were all overweight, and a lot of them had underlying, medical conditions. And so when that particular study came out, what it did suggest at that time was that there may be an excess of, heart attacks and breast cancer. And so that really put the lid on, HRT, and everybody, the newspapers, and you can imagine something like The Sun would carry it and say, and so there was all of this hullabaloo in the, in the newspaper that was screaming about how bad HRT was, without allowing the actual details to be, to be sifted out from all of that noise. And so a lot of, women who were on HRT were actually asked to come off it. And so now, with what happens, that there are some other studies that have come through, as well as going back to look at that original study to find out, exactly what was the data, what did the data say, how was the study, how was the study actually conducted, and how was the information interpreted. And so what we know now, based on the newer studies, and of course looking at the old study, is that, one of the major problems in that particular study was that the doses of the hormones were much, 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 much higher than you would use now. That's one thing. Secondly, they used a kind of Premarin, which is horse urine hormone.
Wow.
And that's no longer used.
Oh my goodness.
Absolutely. They have to get the hormone from somewhere.
Right, fair enough. Yeah, I guess.
Absolutely. And of course, they also looked at the method of administration.
Okay.
So so one important takeaway that I would say anybody who's going to watch this, who's watching it now, or who's going to watch it in later, is the HRT has two components. It has an estrogen and a progestogen. So those are the two main hormones. You can use testosterone, but that is usually done in a specialist clinic. So your GP or your first contact menopausal clinician would normally give you a combination of an estrogen and a progestogen, depending on your circumstance. So if you've had a hysterectomy, that means you've had your womb and your ovaries removed, then your womb in particular removed, then you only need one component of the hormones, and that's the estrogen. You don't need the progestogen. Right. Yes. If you have if you have your womb intact, then you must have both. You must have the estrogen and the progestogen. Now, what the safety studies have shown is that the safest way to have your estrogen administered is transdermal. That's through the skin.
Okay.
Yes. So what happens is, if you put the estrogen through, if you take it orally, it goes through what we call first pass. So it goes first pass through your liver, and that liver conversion then means that you get other other breakdown components of the estrogen that are less healthy for you. So the best way to avoid that is to have your estrogen transdermally. So you normally have either a patch or a gel, and you'd only be going for an oral tablet if the others don't work. And of course, you need to make sure that you're having yourself checked and monitored regularly with your clinician. And of course, you have what you call the progestogen component can be given in several ways. So you can either have it as a coil, if you have what we call the intrauterine system, the IUS, which is the Mirena for most people. And that one of the good things about that is that it does two things. So if it will give you the progestogen you need, and it will also prevent pregnancy.
Right. Okay.
So if your family's, kind of like I said, we talked earlier about could you be pregnant and could you get pregnant in the perimenopause, and yes, you can. So we've talked about that. But if you want something that's going to help prevent pregnancy during that period, then the best thing really is to actually think about, and of course it will not be right, it has to be what's right for you, but think about having a coil fitted. The Mirena coil lasts 5 years. So you might only have to have it changed once, sometimes twice, and that's all. And that will give you the progestogen component of, your HRT. And then, of course, all you need is either a patch or a gel to supplement the estrogen content. If, on the other hand, the coil is not for you, then you need to be thinking about what you call body identical progestogens. And so your body identical progestogens are what we call micronized progestogen. So it is a type of progesterone that mimics the ones that your body makes. That's why it's called body identical. And so those are the kind of things that you need to be talking to your doctor about. So if they say, oh, just take a tablet, you need to say, well, no, I've read it somewhere, I've done a bit of research, I've been told that I can either have a patch or I should have, I can have a gel. Come a little bit informed, so that you can have, you make sure that you're having the discussion you need. But really, that is the safest way by which you can have HRT. Now, HRT is not the only way by which you can manage the menopause, but it is the most effective.
Okay.
It will not work for everyone, and it will not work for everyone at all times. But even if there are some particular areas, there are some particular women for whom the HRT will not be suitable. But on the whole, what we're finding is that it's only just a small, a very small group of women that will not, for whom HRT. So if you have a very high breast cancer risk, that's definitely the sort of thing that you want to be talking to your your specialist, not even your GP. You need to be referred to a specialist about. If you've had breast cancer, can I still have a HRT? That's a discussion that you would have with your menopause specialist.
Okay.
That sort of thing. If you're coming, some people wait until they're in their late 50s and they think, what, I've suffered this thing too much. I'm still working. We know that the retirement age now for women is going into it's almost 70, 67, 65, 67. Honestly, you get what I mean? So if you're going to have to keep working up until that time, you have to make sure that your body is fit. So, if you're working at that point and you're coming into the HRT at a later age, so probably your late 50s, that sort of thing, it's not that you can't have it, but you need to be having those discussions. You get what I mean? To look at the risk and the benefit. As to what will work for you. So, there are a few scenarios that you really need to be having those discussions about what is suitable and what is not, and then what are the other things. And of course, in everything that we do as individuals, as we live in our bodies, there are some areas that you can never go wrong on. So the things that would be like having good exercise, make sure that you're exercising. And I always tell people, you don't have to go to the gym. Exercising is not going to the gym. If you like it and you love it and that's your thing, brilliant. But if you don't, find something that you do like. It can be in front of your TV, it can be going out for a walk, it can be swimming, it can be dancing, it can be, Zumba dancing, it can be, whatever it is that tickles your fancy, do it. Don't come home every day and plop in front of the TV. Get what I mean? Find something to keep your body, because what it does is that it keeps your heart healthy, it keeps your lungs healthy. A lot of studies have shown that people who do exercise, they have much more joint mobility and joint subtlety. It will help reduce the onset of arthritis and joint pains. So definitely those are things you need to be looking at. Another thing that we, especially as Afro-Caribbean women, need to do is look at optimizing our weight.
Okay.
So we know that if you're carrying too much weight, apart from anything, we know that weight is not good for so many things, for your health, for your, cardiovascular health. It puts you at high risk of diabetes. It puts you at high risk of dementia. It also increases your risk of breast cancer.
Okay, right.
Yes. So, we really say, look at making sure that you're optimizing your weight. And, I'm not saying that it's easy, but, you need to think about life. I never like the word diet, because I think, I always think of it, you get on a diet, you go on a journey, you come off again. And so what do? You're going round in circles. So it's lifestyle changes, looking at those lifestyle changes that will keep you healthy. Meditation, making sure that you're learning how to de-stress, those sorts of things. Healthy eating, you've got enough fruit and veg, and a healthy balance of foods, and of course the quantity of your foods. So making sure that you're looking after that. If you drink, make sure you minimize the amount of alcohol you drink. The current government limit is 14 units per week for a woman, but you don't want to have to drink every single day. Make sure that you're having drink-free days if you do drink. Smoking, to my mind, has no benefit at all whatever. There's no benefit to it. So if you do smoke, don't smoke. It's easy for me to say, but
yeah.
But there is a lot of help out there. So these are sorts of things you can go to your GP and say, look, I've got to an age where I really need to be looking after my body. I need to be thinking about my long-term health. What can I do? I want to, help with stop smoking. Every GP clinic now has a stop smoking advisor, or the NHS will, free of charge. You don't pay a penny for it, and that will help you. A lot of GP clinics now have access to weight management schemes, so things like Weight Watchers and Slimming World, and for a limited time, but at least it helps you get on that train to get you going to where you need to go. So there are a lot of things that can be done. You can do with yourself, if and then of course the power of community. Make sure that you have a good community around you, a supportive community, whether it's of friends or family, that sort of thing. Religion, we know, is very good. So if that's if there are ways by which you can help improve your spiritual self, that sort of thing, whatever it is, you want to be looking after the whole of you, especially as you go, as you get older. And so all of these things become important. And of course, please, everybody, ladies, please get your blood pressure checked. If you're going menopausal, get your blood pressure checked. You need to know your blood pressure. You need to get your blood pressure checked. You need to have your blood test done. Make sure you're not diabetic.
Right.
All of those basic things, get them done early, so know your cholesterol. Make sure you understand what your cholesterol numbers are, so that you know how to adjust your diet effectively. And if you're good, it's fine. And if it's not, that you can take control and then begin to make the changes that you need to make.
Amazing. Thank you so much. I mean, honestly, you've given us so much information. We often think the menopause, it's just my body shutting down from having babies anymore. But actually, you said the menopause impacts every single part of being a woman, literally from your weight to your mental health, everything. So I didn't even think of it like that. So thank you so much for opening our eyes to what the menopause really is, going over the perimenopause, and definitely talking to us about the hormone replacement treatment as well. So thank you so much. We have come to the end. Dr. Pearl, if people wanted to get in touch with you, do you have like a social media that they can contact you on at all?
Absolutely. So what I'll do is I'll send it to you, Adam, so you can put it up on the chat if on your site. Yes.
Amazing.
Yes.
No, thank you so much. So guys, I'll make sure to do that and include it in the description below. So guys, if you've enjoyed it, please like and subscribe and share. Please share with the women in your community, please. We all need to know this information, and also to the teenagers as well, so that when they get to that point, it's not a shock to the system. They know what to expect. All right. Thank you so much, Dr. Pearl.
Thank you, everybody, for watching. Absolutely. I've had a lovely time. Thank you so much. And I hope we can, have that conversation, keep having those conversations.
Absolutely. Thank you so much. You take care of yourself.
Thank you.
Bye-bye. So that's it, guys. That's the end of the Womanhood series, talking about the science behind the menopause. Thank you so much for being with us. Again, make sure you like, share, and subscribe, and we will see you next time. Take care. Bye-bye.